Today, we're diving into something that I think a lot of people are interested in, concussions in adults.
Yeah.
And, you might be listening because you've had one, or maybe you're just curious about this common injury.
Yeah, they're actually more common than you think, and there are a lot of misconceptions surrounding them. So hopefully this deep dive will help clear some of those up.
Yeah, for sure.
And just to let you know, we're working with a really reliable patient education guide on concussions today, which is a great place to start for anyone wanting to learn more.
Yeah, it's a really straightforward guide. It gets straight to the point and defines a concussion as a mild traumatic brain injury.
Right to the point.
Which basically means that it's not just a bump on the head.
Right.
It's an actual injury to the brain itself.
Yeah, and one of the things that stood out to me was that the guide really emphasized that this injury is functional, meaning that it disrupts how the brain works instead of causing, that visible structural damage that people usually associate with brain injuries.
Yeah, that's a good point. It's not like a broken bone or something.
Right, exactly. It's more like, think of it like this. A concussion kind of shakes things up in your brain and affects how your neurons talk to each other.
Oh, okay.
It's like a temporary glitch in the system, not necessarily a broken wire,
Yeah, that's a really good analogy.
Yeah.
So it's not about a physical break, but more like a disruption in how the brain functions.
Exactly.
Okay, well, speaking of disruptions, I'm curious to know, what are some of the usual suspects behind these concussions?
Well, most people think of sports when they think of concussions.
Yeah, for sure.
And that's definitely a big contributor, but it's not the only cause.
Right.
Our guide actually highlights everyday accidents as culprits too, like falls, which can happen to anyone really.
Oh, yeah.
And also car accidents.
So it's not just about those big hits we see on the football field then?
No, not at all.
Yeah.
Even seemingly minor bumps can lead to concussions if the force is strong enough or if the head movement is sudden and jarring. It all comes down to how the brain reacts to that force.
That makes me think about how people used to always say that you had to black out to have a concussion.
Oh, yeah.
Does this guide talk about that at all?
It does. It actually debunks that myth right away.
Interesting.
One of the first things it clarifies is that you don't necessarily have to lose consciousness to have a concussion.
Really?
Yeah, a lot of people with concussions never black out. They might just feel dazed or confused for a bit.
Wow, that's a big takeaway right there. So someone might not even realize they have a concussion if they don't lose consciousness.
Yeah, that's right. And it can be a little scary because, how do you know?
Yeah, what are some other signs that people should look out for?
Well, the guide lists quite a few, and they can differ from person to person.
Okay.
Some symptoms are immediate, like you might feel confused or disoriented.
Right.
Have trouble remembering what just happened, or even experience a headache, dizziness, or nausea.
So it's not always like seeing stars or something.
Oh, not always. Sometimes the symptoms are more subtle and they might not appear right away. This is where it can get a little tricky because delayed symptoms can actually emerge hours, days, or even weeks later.
Wow.
Things like difficulty concentrating, trouble, sleeping, irritability, or even sensitivity to light and noise.
So it sounds like recognizing a concussion isn't always easy.
Yeah, it can be tough.
Which makes me wonder about the diagnosis process. How do doctors actually figure out if someone has a concussion?
That's a great question.
And what role does brain imaging play in that?
Yeah, the guide addresses that directly. It explains that doctors use a combination of things to diagnose a concussion.
Right.
They'll usually start by asking you about your symptoms and what happened when you got injured, and then they'll do a physical exam to check for any neurological problems.
Okay.
They might also use some cognitive tests to assess things like your memory, concentration, and thinking skills.
So they're really trying to get a good picture of how your brain is working.
Yeah, exactly.
So it's not just about getting a scan then.
Not always. While imaging tests like CT scans and MRIs can be helpful in ruling out more serious brain injuries, they're not always necessary for diagnosing a concussion. In fact, the guide actually points out that CT scans, which mainly look at the structure of the brain, often come back normal in concussion cases. Because remember, a concussion is a functional injury, not necessarily a structural one.
Oh, right. Yeah.
So it's not always about looking for damage on a scan.
That's reassuring to know.
Yeah.
Especially for someone who might be worried about needing a scan after every little bump on the head.
Exactly.
It sounds like they're really reserved for more serious situations where a more severe injury is suspected.
Yeah, that's right.
So now what about treatment? What happens once a concussion is diagnosed? So what happens after a concussion is diagnosed? What does treatment usually look like?
Well, the guide really stresses that treating a concussion is all about managing those symptoms you were talking about
Okay.
and making sure the brain gets enough rest to heal properly.
Oh, so it's like hitting the pause button on your regular activities for a bit.
Yeah, exactly. It's like giving your brain a timeout so it can recover.
So no trying to push through it or anything like that?
No, definitely not. The brain needs time to reset and rebalance after a concussion,
Right.
and that means both physical and mental rest are super important.
So rest is really the key here. But what does that actually look like? I mean, I'm guessing it's more than just getting some extra sleep.
Yeah, you're right. The guide points out that mental rest is just as important as physical rest.
Huh.
So it's not just about avoiding physical activity, it's also about staying away from things that require a lot of concentration or mental effort.
Oh, duh.
Things like reading, working on the computer, or even watching too much TV can actually strain the brain and slow down the recovery process.
Oh, wow. So even those things can be a problem.
Yeah, it might seem counterintuitive, but even those seemingly harmless activities can hinder the healing process.
I guess it makes sense when you think about it. The brain needs a break from all kinds of stimulation,
Yeah.
not just the physical stuff.
Exactly. It's about giving your brain the space and quiet it needs to repair itself.
Right.
The guide even mentions that video games, which can be pretty stimulating, might actually worsen symptoms in some cases.
So no marathon gaming sessions while recovering from a concussion.
Right.
Got it.
Right.
But what about getting back to normal life? When is it safe to go back to work or school or sports after a concussion?
That's a really important question. And the guide emphasizes that it's best to follow a doctor's advice on this one.
Okay.
They'll be able to assess your progress and help you gradually return to your normal activities.
Okay.
The key is to avoid pushing yourself too hard too soon, because that can increase the risk of another concussion or make your recovery take even longer.
So it's all about easing back into things slowly.
Exactly. It's like a gradual re-entry program for your brain.
Makes sense.
Yeah.
Now, are there any warning signs that someone should watch out for after a concussion? Like signs that something more serious might be happening?
Absolutely. The guide lists a few emergency symptoms that require immediate medical attention.
Okay.
Losing consciousness, even if it's just for a short time, is a big red flag.
No.
Other worrying signs include a headache that keeps getting worse, repeated vomiting, slurred speech weakness, or numbness in any part of the body, and seizures.
Wow, those definitely sound serious. What should someone do if they experience any of those symptoms?
Call 911 or go to the nearest emergency room right away.
Yep.
Those symptoms could mean there's a more serious brain injury that needs urgent care.
So it's always better to err on the side of caution and get medical help if you're not sure about something.
Exactly. You're absolutely right. It's always better to be safe than sorry, especially when it comes to brain injuries.
Right.
Even if you don't have those emergency symptoms, the guide still recommends having someone keep an eye on you for at least 12 to 24 hours after a concussion.
So having a buddy system is a good idea.
Yeah, exactly. It's helpful to have someone around who can notice any changes in your behavior or symptoms and get help if you need it.
Okay, so we've talked a lot about recognizing and managing concussions.
Mm-hmm.
But what about preventing them in the first place? Are there things people can do to lower their risk?
Definitely. The guide highlights some simple but effective ways to prevent concussions.
Okay, like what?
Well, wearing a helmet when you're playing sports or doing activities like biking and skateboarding is a no-brainer.
Literally a no-brainer.
Right. It seems obvious, but it's so important.
Right.
And then another simple thing is wearing your seatbelt every time you're in a car.
Right.
That can really reduce your risk of a head injury if you're in an accident.
Yeah, that's a good point.
The guide also reminds us to be aware of our surroundings and try to prevent falls, especially for older adults who might be more prone to those kinds of injuries.
It seems like common sense, but it's good to be reminded of these things sometimes.
You're right. We often forget about the simple things.
So we've covered a lot of ground today.
Yeah.
As we wrap up, what are the key takeaways you want our listeners to remember?
I think the most important thing to remember is that concussions are a real brain injury even if you don't lose consciousness.
Right. It's not something to take lightly.
Exactly. And we need to recognize the signs and symptoms and take them seriously.
Yeah, no more brushing it off as just a bump on the head.
Exactly. Another crucial point is that those delayed symptoms we talked about are pretty common and can be hard to spot. So it's really important to pay attention to how you're feeling in the days and weeks after you hit your head.
And of course, getting medical help when you need it. Whether it's for those serious red flags or for symptoms that just won't go away.
Absolutely. And lastly, don't forget about those preventative measures. Helmets, seatbelts, all that good stuff can really make a difference in lowering your risk of getting a concussion in the first place.
All great advice.
Ah.
This guide has given us a lot of helpful information about concussions. But before we go, it leaves us with a pretty thought-provoking question.
It does. It really makes you think about the bigger picture.
Yeah, it really gets you thinking about how we can move from just reacting to concussions to actually preventing them.
It's a good point. It's about building environments where safety comes first
Right.
and making sure that everyone understands how to protect their brain health.
Well said. I think this deep dive has been really eye-opening for all of us. We've learned that concussions are much more than just a bump on the head.
Right.
They're a serious brain injury, and they need to be treated that way.
Yeah, and it's important to remember that every concussion is different. So while this guide has given us some really useful information,
Yeah.
it's always best to talk to a doctor or healthcare professional if you have any concerns or, need specific advice for your situation.
Absolutely. Well, we've definitely covered a lot today, but like you said, there's always more to learn.
Always.
And we encourage everyone listening to keep digging into this topic and to really advocate for your health and the health of the people around you.
Knowledge is power. And when it comes to concussions, that power can help us create safer practices and better outcomes for everyone.
I couldn't agree more. Well, thanks for joining us on this deep dive into the world of concussions. We hope you learned a lot and that you feel more confident about taking care of your brain health.
Yeah, thanks for listening, everyone.
And until next time, stay curious, stay safe, and keep those brains healthy.